How can you self-diagnose low back pain, sciatica, and hip pain from home without needing to get an MRI or special tests? Obviously, you want to know the root cause of your pain. By the way, these models suck. Your discs are actually very tough stuff, not like this at all. You've heard conflicting information about the source of your pain. Is it coming from your low back, your lumbar spine? Is it the SI joint or sacroiliac joint? Or maybe it's a hip joint issue right here. Or is it a nerve coming from sciatica, like the sciatic nerve? In this video, we'll explore movements that you can do from home in order to understand more about the structural factors and the cause of your pain. And even more importantly, I'll show you why these tests will only reveal one piece of the pie. Because even if we could say with 100% certainty that, let's say, the sacroiliac joint is contributing to your pain, which would be impossible to have 100% certainty, by the way, we still wouldn't have a full answer about the cause of your pain, because structure is just one part of pain. We also have beliefs, stress, fear, inflammation, hypersensitization, expectation, context, and recovery to think about. Those things are just as important when it comes to understanding the root cause of your pain. So this video talks about the structure, but don't forget that structure in the spine is just one piece of the puzzle. Hey, real quick, I'm Dr. Anthony Davis, and I empower people with chronic low back pain and sciatica to reclaim the active life they love using holistic, evidence-based rehab. If you want a deep dive on how to conquer chronic pain, watch the masterclass. Link is in the description. Now let's talk about how to self-diagnose and tell the difference between low back pain, SI joint pain, hip pain, and nerve issues. Keep in mind, you might have more than one structure that's contributing to your pain. In fact, that's usually the case because there's no such thing as isolation in the human body. First, a quick disclaimer about red flags. If you've never seen any kind of healthcare provider for your pain, it's important to get a proper exam and rule out red flags. Pain in the back or the hips could happen for many reasons, some of which might be coming from organs or other sinister causes, and only your doctor can screen for those things. Some things to watch out for that might indicate more serious nerve damage are major weakness in your foot, saddle anesthesia, which is numbness or tingling in the groin on both sides where a saddle would be if you were riding a horse, or incontinence, which is a loss of control of your bowel or bladder. Most of the time, as long as someone doesn't have any of those symptoms, it's safe to manage their pain conservatively with education and exercise. So let's dive in. Let's start with sciatica, because it's the most obvious. First off, do you have pain, numbness, or tingling that radiates from the hip on one side down the leg, past the knee, and maybe even into the ankle or the foot or the toes? If so, you probably have sciatica, especially if it's what we call lancinating pain. That's a tight band of shooting pain zipping down the leg. Next, if it's sciatica, it will likely be worse when you stretch the sciatic nerve. The easiest test for this is to sit in a chair and straighten out one leg at a time. You'll do both sides, and one side might feel fine while the other side creates sciatic symptoms, numbness and tingling going down the back of the leg. If the straight leg raise reproduces symptoms, but only on the symptomatic side, in other words, one side feels worse than the other, then it's probably sciatica. If, on the other hand, it just feels like a deep stretch, then we'll try the same thing again, but this time with a rounded spine and tucking your chin. And if this version of the slump test reproduces your nervy symptoms, then it's very likely sciatic nerve irritation. If not, then it's probably not really coming from true nerve compression. By the way, you may have heard of piriformis syndrome, which is where this little muscle underneath the glute muscles compresses the sciatic nerve right here. The trouble is, this is not well proven, and most likely pain that radiates just into the hip and the hamstring, but not past the knee, we would typically just call somatic referred pain. This basically means that some combination of the muscles, joints, or other structures in the low back and pelvis are irritated and tricking the brain into thinking that it's coming from the hip and thigh. It's basically impossible for us to tell with 100% certainty that 100% of your pain is coming from one single structure. So we can't just blame the piriformis muscle. But this trick of referred pain is kind of like when you eat ice cream and you get a brain freeze. There's nothing wrong with your brain. Same thing when you get referred pain into the hip and thigh. There's nothing wrong with your thigh. Other structures in that area are sensitive. That said, piriformis stretching is just fine for sciatica or somatic referred pain, although I generally prefer focusing on strength building exercises in both cases. Stretching is only a temporary pain reliever. Not bad, but not a long-term solution. Now let's talk about low back or lumbar spine causes of pain. And I know most of you are probably thinking about disc herniations and disc bulges. Again, just a quick reminder that structure alone cannot fully explain pain. That said, let's figure out if the low back structures like the discs or the joints or even the sacroiliac joint might be part of your pain. The most obvious question is, where is your pain? Where is it located? Is it one side? Or is it both sides? If it's really pinpoint and sharp, it's more likely to be a joint or a disc that might be irritated. But if it's more dull and achy and along these muscular bands called the erector muscles, then it's more likely to just be muscular. Is it above or below the waistband? If it's below the waistband near the hips, it might be more of a sacroiliac joint issue. One way to tell low back disc or joint issues is that you get a sharp pain with transitional movements like sitting down or standing up out of a chair. So if when you roll over in bed, you get sharp pain or quickly twisting to grab something or open a door, but then if you take a big breath and hold it while you do these activities, and suddenly the pain becomes less noticeable or goes away, then maybe stability of the joints and discs is helping to reduce your symptoms. If you think that's you, try this with me. Laying on your back, if rolling over normally hurts, then go back to the starting position. Now, take a deep breath and hold it in the belly as you rolled over. Hold the breath. And then once you're in this end position, then let the breath out. So if this helped, then you might have some sensitivity in the spinal discs or joints that's brought on by excessive motion, because bracing seems to help relieve the pain. Quick tip. If core bracing helps, remember, this is not a long-term strategy. Core bracing should only be used temporarily while things are really sensitive. The goal should be to return to normal activity and bending and lifting and twisting the spine safely without having to think about it. Lastly, let's talk about the sacroiliac or SI joint. If your pain is located right here over this bony bump called the PSIS, and maybe it radiates a little bit into the glutes or outer hip, then there's a decent chance that the sacroiliac joint is involved. One way to test this is simply stand up, take your hands to your hips with knees straight, send the hips forward, and lean the shoulders backwards. Now, if this hurts right here, take a note of that. Next, try a lunge on each side, starting with the good side back. So if my left side does not hurt, it's back first. Then send the hips way forward and lean backwards from here, and put some pressure on your hip to push it forward. And make sure to try both sides and compare. If you get a sharp pain over the PSIS or SI joint while you're doing this, it's probably sacroiliac joint pain. The good news is the SI joint is really strong. It doesn't go out of place. That's not a real thing. It's not misaligned, and it does not have a disorder. It's just sensitive. You might have overdone it. So how do you fix it? Get strong. Lastly, let's talk about hip joint pain. And just to be clear, hip pain is coming from the actual hip joint right here. Sometimes people call hip pain this area here, which again is SI joint. So if it's way lower, all the way down here, then maybe it's hip joint. So if your pain is deep inside the hip, where the hip crease would be when you flex the hip, or if it's pain that radiates like a C-claw shape around the outer hip, then it might be hip joint pain. If it hurts in this area specifically when you hit your heel while you're walking, basically impact on the heel reverberates up into the hip joint and it causes hip pain, then it might be hip pain. Another test is the Fader test, which is flexion, adduction, and internal rotation. Try this by laying on your back, hugging your knee into the chest, and aiming the knee towards the opposite shoulder and squeeze the knee in. If you get sharp pain deep in the front of the hip, this might be hip impingement. And this is just a little bit of bony pinching in the ball and socket joint, which is not a huge deal. It's something to work around. I have hip impingement. It doesn't really matter. I rehabbed it. I'm just fine. Another test is the Faber test, which is flexion, abduction, and external rotation. So lay on your back, place your foot on the ground, and let the side knee lower as far as it can out to the side. Now, if this creates a deep, sharp pain in the hip joint, then it might be a hip joint issue such as a labral tear or arthritis. Again, not a huge deal. I have a labral tear, I'm fine. It is something that you can work around. Let's review. Most of the diagnosis comes from the history, not the physical exam. So the location of your symptom usually gives us most of the answer. If it shoots down the entire leg, it's probably sciatica. If it doesn't go past the knee, then it might not be true nerve pain. If it's sharp pain right over the PSIS, it's probably sacroiliac joint pain. And if it's deep in the crease of the hip and wrapping around like a C shape of the hip, then maybe it's hip joint pain. So now you know how to identify common structural factors of pain. But like I said, that's not the whole picture. If you want to understand the real root cause of your pain, I made a video teaching you the whole story about the real cause of low back pain and sciatica. So be sure to watch that video next. It's appearing on your screen now, and I'll see you there.